Record as method of data collection. Research, 10 marks. Introduction. All professional persons need to be accountable for the performance of the duties to the public. Since nursing has been considered as profession, nurses need to record their work on completion. Records are a practical and indispensable aid to the doctor, nurse and paramedical personnel in giving the best possible service to the client's report summarizes the services of the person or personnel or of agency. Various methods of collecting data are employed by social scientists. The task of data collection begins after a research problem has been defined and research design chalked out. Records are a valuable and lucrative source of nursing research data. Records are an ever-present source of material. Records are found everywhere in homes, offices and places of leisure. Students keep records even though they may be only names of person with whom they correspond and bank account records. Most people keep some types of records: recipes, chips, sales slips or business transactions. Records are available in every department. Types of data. Primary data are those which are collected afresh and for the first time and does happen to be original in character and known as primary data. Secondary data are those which have been collected by someone else and which have already been passed to statistical process are known as secondary data. Collection of primary data. The methods are 1. Observation method, 2. Interview method, 3. Questionnaire method, 4. Schedule method, 5. Case study method, 6. Survey method, 7. Panel method. Collection of secondary data sources. A publication of central, state and local government technical and trade journals, books, magazines, newspaper reports and publications. Reports by research scholars, universities, economists. Public record. Definition: records the memory of the internal and external transaction of an organization. Records contain a written evidence of the activities of an organization in the form of letters, circulars, reports, contracts, invoices, vouchers, minute of meeting, book of account, etc. Records are written communication that permanently documents information relevant to the client's healthcare management. It is a continuing account of the client's healthcare needs. Record is formally legal, administrative tool that permanently document information relevant to direct or indirect patient care. Records are administrative devices used to collect and classify information. Records are the information kept in the health unit on the work of the unit, on the health conditions in the community, on individual patients, as well as the information on administrative matters, stars, equipment, supplies, etc. A record is a permanent written communication that documents information relevant to a client's healthcare management. A record is a permanent written communication that documents information relevant to the client healthcare management. A record is a clinical, scientific, administrative and legal document related to the nursing care given to the individual, family or community. Reports are oral or written exchanges of information shared between caregivers for workers in a number of ways. A report is a summary of the services of person or personnel and of the agency. Records are compilation of writings and figures that individuals have collected. Principles of maintaining records. Nursery should develop their own method of expression and form more in record writing. Clearly written, appropriate, adequate, valuable legal documents and so should be handled carefully and accounted for. Records are confidential documents accurately dated, time and sign specific purpose which should be clearly understood. Items on forms and in registers should be conveniently grouped so as to make their completion as easy as possible. The wording should be easy to understand and where doubt is likely to arise, instructions to facilitate interpretation should be included. Records should permit some freedom of expression. Records which are required by the teaching staff should be easily accessible to them. Person responsible for maintaining records should be aware of their particular responsibility and every effort should be made to keep records up to date and accurate. Provision for periodic review of all records to ensure that they keep pace with the changing needs of the program. Adequate supply of stationery to permit records to be maintained on the proper forms and in the proper registers at all times. Sufficient number of filing cabinets and appropriate equipment to operate a filing system which is simple and safe and requires the minimum possible time. Adequate, safe, file-proof of storage arrangements. Nurses should develop their own method of expression and form in record writing. Records should be written clearly, Appropriately and legibility records should contain facts based on observation. Conservation, action. Select relevant facts and the recording should be neat, complete and uniform. Records are valuable legal documents and so it should be handled carefully and accounted for. Record systems are essential for efficiency and uniformity of services. Records should provide for periodic summary to determine progress and to make future plans. Records should be written immediately after an interview. Records are confidential documents. Characteristics of good recording and reporting: accuracy, consciousness, thoroughness, up-to-date organization, confidentiality, objectivity. Purpose of keeping records: supply data that are essential for program planning and evaluation. Provide the practitioner with data required for the application of professional services for improvement of the family health. Tools of communication between health workers, the family and other developmental personnel. Effective health reports show the health problem in the family and other factors that affect health. Indicates plan for future help in the research for improvement of nursing care. Records are the administration's memory. Records are an important tool in controlling and assessing work. They are kept to help the supervisor to learn what is taking place, make effective decisions, assess progress towards goals, provide an insight for pre-planning purposes. Communication aids to diagnosis, education, documentation of continuity, research, legal documentation. Individual case study provides staff members, administrator or any other members and not only members of the health team with documentation of services that has been rendered and supply data that are essential for the program planning and evaluation. Provide the practitioner with data required for the application of professional services for the improvement of family health. Records are tools of communication. Effective world record shows the health problem in the family and other factors that affect health. Thus it is more than a standardized sheet or a form. Record indicates plans for future. It provides baseline data to estimate the long-term changes related to services. Values, uses of records show the health conditions as it is and as the patient and family accepts it goes towards, which means are to be directed, prevents duplication of services and helps follow up services effectively, helps the nurse to evaluate the care and the teaching. Organization of work serves as a guide for diagnosis, treatment and evaluation of services. Indicate progress used in research. The health assess and needs of the village areas. Record provides basic facts for services, provides a basis for analyzing needs in terms of what has been done, what is being done and what is to be done and the goals towards, which means are to be directed. Provides a basis for short and long-term planning. It prevents duplication of services and helps follow-up of services efficiently, helps the nurse to evaluate the care and the teaching which she has given. It helps the nurse organize work in an orderly way and to make an effective use of the time as it serves as a guide to professional growth. It enables a nurse to judge the quality and quantity of work done. Record serves as a guide for diagnosis, treatment and evaluation of services. It indicates progress. It may be used in research. The records helps identify families needing service and those prepared to accept help. It enables him to draw the nurse's attention towards any pertinent observation he has made. Advantages: records are unbiased. The person who collected the data had no knowledge of their future use. He did not expect that beginning or professional researchers would be delving into files or storage rooms to look through the records that were collected. Therefore, the records are unbiased as far as the researcher is concerned. For the purpose of a particular project, records often cover a long period of time. This is a valuable feature. With the use of records, researchers can discover events and trends covering many months or years. Records are inexpensive. All the data available at one time. Numbers or statistics are in tables or other convenient forms readily accessible to the researcher. Pertinent information can even be selected by assistants who have been trained. Records are convenient and time-saving. Little work is required on the researcher's part after they are located, except for processing the data. Records are available in their pure form, compiled in neat and orderly fashion. After gathering from subjects, the researcher must do a great deal of work to put it into some form of analysis. However, at least the records provide readily available data. Because I have already been collected, the researcher cannot bias all the subjects. In other forms of data gathering, The process itself may upset the subjects or the investigator may have some effect on the sample population. The existence of a large quantity of records often allows the researcher a considerable choice of data. It may be possible to validate or cross-check recorded data from one source with another source. Cross-checking is traditional methods, such as comparing responses from interviews and questionnaires, requires considerable time and effort. Data obtained by an unobstructed method disadvantages, the amount of information is limited to what is available. Researchers cannot update any more data because the subjects are not present. If the record is incomplete, there is no way that it can be completed. Any omissions have to remain, they cannot be recovered. No one can be sure of the conditions under which the records were collected. Was more than one person involved in compiling the data? How careful were the people who handled the facts and figures? Were the records collected for more than one purpose? It is possible that the records were stated in such general terms that their meaning is questionable. There is no assurance of the accuracy of the records. Quite often dates written near the beginning of the new year may be wrong since the winter was used to dating written reports with the past year. At best, both written records and artifacts may not be circumstantial evidence. The people who preserved the original records had no idea that they would be used for research. Therefore the researcher is forced to admit any error into the study that was built into the original records. There may be some serious drawbacks in the material of which the researcher is not aware. The person who recorded the data study have recorded only one type of data or may have been interested in only one factor. The collector may have had some personal bias that affected the material, but there is no way of knowing if some of the material is actually irrelevant to the researcher's purpose. It may still be necessary to sift through the data to glean what information is really needed. Types of records: 1. Patient clinical record. 2. Individual staff records. 3. Ward records. 4. Administrative records with educational value. 5. Periodically. 6. Unit-based. 7. Subject-based. 8. Collection-based. Patient's clinical records. It is the knowledge of events in the patient's illness, progress in his or her recovery and the type of care given by the hospital personnel. It is scientific and legal evidence to the patient's his or her case is intelligently managed to avoid duplication of work information for medical and legal nursing research aids in the promotion of health and care legal protection to the hospital doctor and nurse, nursing administrator's responsibility, protection from loss safeguarding its contents completeness responsibility of nurse's notes legal value of nurse's notes admission record scientific value of the nurse's notes record of order carried out individual staff record a separate set of record is needed for staff, giving details of the sickness and absences and their career and development activities and a personal note ward records reductive or increase in beds change in medical staff and non-nursing personnel for the word introduction on pattern of support periodically permanent records example cumulative records temporary records example casual or daily records unit-based individual record example individual health card related to family example family folder related to health sector example records of health problems national record example national health program record subject-based record example economical social and political and medical and nursing records collection place-based record collection at institutions example records of hospital and healthcare center records to be kept with the individual example immunization and disease card administrative records with educational value treatments admissions equipments losses and replacements personal performance other administrative records types of records in the Department of Public Health 1. Cumulative or continuing records 2. Family records 3. Registers 4. Reports cumulative or continuing records this is found to be time-saving, economical and also it is helpful to review the total history of an individual and evaluate the progress of a long period filing and arranging of record alphabetically numerically geographical with index cards. Introduction to nursing record reports can be compiled daily, weekly, monthly or quarterly and annually. Summarizes the services of the nurse and the agencies. Reports may be in the form of an analysis of some aspect of a service. These are based on records and registers, and so it is relevant for the nurses to maintain records regarding their daily care and caseload, service load and activities. Record keeping system. Source: record problem-oriented nursing Cardex computerized information system. It has three major categories: clinical system, management information system, educational system. Problems: the foremost problem in using records as research data is locating the place where they have been stored. It may be necessary to obtain permission from several individuals before final resource is made possible. Records are stored, published in books that may be located in libraries or put in files. It may be difficult to obtain access to them, whether they are written or artifacts. Perhaps an office has a series of records in its files, but the people working there do not want to allow an outsider to come in and disturb the office routine by going through rows and rows of various files and putting out information. Another problem is that there may be a reason why the organization or institution does not want anyone other than selected individuals to go through their private files. They may permit resort to use information if arrangements are made to retrieve the data without exposing individual names. If computer printout form is available, it may be possible to gain access to the stored information. If data is not available in anonymous form, it might require the assistance of office personnel to retrieve the information. After the organization does not have time for one of the employees to assist. However, if absolutely necessary, the researcher may pay one of the employees to collect the data. Often records are in such a form that it would be difficult to understand them. The researcher may require help in interpreting the meaning of words, figures and symbols. With computer printouts, it may be quite difficult for the researcher to understand the data until they are explained. Another problem with records is item equivalency. Proposer researcher want to compare information about how clients are served by one nursing center with another. Are their record item equivalent? Are records based on the same criteria? In comparing line sisters, if an institution used type A form and the other institution used type B form, would they yield equivalent information? Records are obtained stored in boxes covered with dust. They may be stored in old basements or attics. It may be known that information is available, but no one seems to be able to locate it. The investigator may be looking for records from a certain year and it may be difficult to find them. Some records are seldom used after they have been compiled. The people who originally compiled the records may have left the organization, died or moved away, and after few years the record's value is forgotten. So for all practical purposes they are actually lost. Some resource records, on the other hand, may be available, but the researcher is unable to gain access to them because permission is not granted. It seems that one of the big problem is the use of records and the people who own them do not want personal names revealed. If the researcher can assure the owners that names will not be made public, access will be granted more readily. To gain permission to use data, the researcher often may have to guarantee anonymity or may have to present a copy of the research finding to the organization for approval. All records of an organization may not be available. Two sources of data may lack item equivalency. Records may require special help in interpretation. Piles contain name of individuals that the administration may not want revealed.